Hi, my name is Amy Robinson. I am a wellness advocate for doTERRA Essential Oils, and I am sitting here today with Dr. Carlos Santo, and he is a board certified naturopathic physician here in the state of Arizona and also the founder of Wellness One Nation. So excited to have you here today. We are going to be talking about men's health and something I'm sure you're an expert at. Being a man
myself and seeing tons of men in my practice, I think I have a beat on it, yes.
Yes. Okay. So, I see all these commercials for men on TV about improving their vitality, reducing their spare tire, or improving their energy and their drive.
Yeah.
How does a man even start to make sense of kind of all the information they're seeing on TV?
It's a multi-billion-dollar industry, the male virility industry, if you will, and we see, of course, the commercials for the drugs, Viagra and Cialis, and it's every man's fear, that they're going to lose their mojo, as you will. And I mean,
Yes.
it's already they're dealing with
Or their hair.
losing their hair, and there are just some things we're not in control of, but there are so many things that we are in control of, and maintaining vitality and, more importantly, optimal wellness and disease prevention well into our elder years is right in our grasp, and we have the ability to do it. The problem is, people don't want to do the hard work, which is, a healthy lifestyle.
Right.
And they want to take a pill for something. There's the bigger picture of the problem. We want a pill for everything, not just men's health, but we'll focus on that today. Excuse me. It's very difficult also to speak about men's health without bringing in the topic of heart disease, because heart disease, of course, has always been thought of as a male problem. It's really not. It's also a female problem. But do you realize, Amy, that heart disease is still the #1 cause of death across all adult age groups, almost all adult age groups, other than homicides in certain younger adult age groups. But heart disease doesn't get a lot of attention, as does cancer, for instance.
We right, absolutely. You don't hear about it as much.
Right, breast cancer awareness is, of course, huge, but heart disease kills way more women than men.
Oh, really?
I'm sorry.
More women, or more?
Heart disease kills many more women than does breast cancer. Like 4 to 5 times as many.
Oh, wow.
But today, more women than men die of heart attack and stroke than do, so that's the amazing thing,
right.
Especially after menopause. So back to the topic at hand. We have been looking down the wrong road for many years. We look at low-fat diets and exercise, and then we stop there. And still people are dropping of heart attacks, and they think it's cholesterol that's causing the problem. We have to think beyond the small picture, because we've been on this anti-cholesterol campaign since the Framingham heart studies of the 1960s. And all it's gotten us is statin drugs, which have done little to nothing to increase people's survivability. Maybe if you've had a heart attack already, statin drugs, for instance, are beneficial. Maybe. We don't even know that. But for people who have never had a heart attack or any kind of heart event, to be on a statin drug, in my opinion, is criminal. It really should not be, because statin drugs actually lower the healthy cholesterol carrier called HDL. And that's right there, increasing a risk for a heart event, #1. Statin drugs also block the most important hormone of our body. You know what that is? Cholesterol.
Cholesterol, yeah.
Yes. Cholesterol is a hormone. The body would never make something that was inherently bad for it, just like fever is not bad. Cholesterol is not bad. And so we block cholesterol, and therefore we affect ourselves on this entire downstream hormone cascade from one drug. Horrible. Not to mention the toxic side effects to the liver and the myopathies, or I should say myalgias, muscle pain, especially in the lower body, the legs. Yeah. Reducing someone's ability to exercise and maintain a healthy and active lifestyle because of this one drug.
Oh, wow.
When we can do all this naturally. Do you know what the #1 cause of high cholesterol is? It's not diet, it's stress. And I did my graduate research on this 25 years ago.
Oh, wow.
And the studies go back to the 1930s. We've known since the 1930s in rat studies and dog studies and eventually in human trials that stress is possibly the #1 greatest contributor to high cholesterol.
Oh, wow.
Because why? Because cholesterol is a survival hormone. When the body is in fight or flight, aka survival mode, it's going to raise this cholesterol to protect the brain, to protect the myelin sheaths of the nerves. Amazing. And here we are on this ridiculous campaign to lower cholesterol, which is so something that we actually need in our bodies to function healthfully. We'll go back to the hormone topic now.
Yeah.
Ken, you might want to know.
Yeah.
You were willing and wanting to ask me this one. Go ahead, let
Yeah.
you ask it.
So can men go through menopause?
That's amazing. And the
A
answer is
man's
yes.
menopause.
Yes, they can. I say they because I don't intend to be in the we category. It all comes down to awareness. We
Okay.
call it andropause. It's a nice convenient term. Who cares, right, what the term is? Men go through significant hormone decline. Now, we mentioned the Viagra and Cialis, and there's always a joke and a chuckle, amongst the golf buddies and who's taking that stuff. Men want to act like 19-year-old boys. Fine, go on ahead and do that. The bottom line is, it's a major industry for reasons because they want to function like they are used to functioning. And it's unfortunate that men have lost the ability to treat themselves naturally. Men don't take a proactive approach to their health care. They only go to the doctor when it's too late,
True.
when it's
So
bothering
true.
them. It's like, maybe it'll go away. That's the 5 worst words someone can utter to themselves or to their spouse. It's not going to go away. Just like when that indicator light comes on that your oil is low in your car, it's not going to go away unless the engine seizes. We don't want to do that to our bodies. So get tested, not only for your heart, proper blood tests, but test your hormones. Find out if there's a trend toward hormone decline. Test at least once a year, starting at age 35. Okay. Because by the time you are 45 and 50, you have already addressed the problem.
So it's about being proactive, preventative.
And then ultimately interventive, if you will.
Yeah.
So do something about it. Okay, so here's my situation. Now we can treat it. And
right.
The nice thing is we have lots of nice options for men.
So,
we start with lifestyle. If they're drinking too much, if their job is just not allowing them to eat properly and to exercise properly, they need to make some serious changes because why are they doing this?
So alcohol is kind of a biggie for a lot of men.
Absolutely.
And yes, I've heard that it raises estrogen levels in men. So men, you might not want more estrogen.
It raises estrogen. It's a major contributor to high estrogen. So estrogen dominance is something that not only affects women, but men. Estrogen dominance, the xenoestrogens we talk about.
So it's good for men to take a phytoestrogen as well.
Absolutely. Because it can block the bad estrogen from attaching to the cell receptor sites.
Now,
go ahead.
Is there a healthy amount of alcohol? I mean, I know there's studies out there and they say, okay, it's okay to drink this much, blah, blah, blah. But regardless of what the study says, what is, is there a healthy alcohol consumption?
Depends on who we're talking about.
Okay.
If someone is balanced and they don't have any complaints, they're functionally well sexually, emotionally, metabolically, then occasional alcohol intake is fine. 1 to 2 drinks a week or maybe twice a week is reasonable. But daily alcohol consumption in anybody, I think, is a bad idea, personally. Only because the world is already toxic enough.
Yeah. We're just keeping
and it's just
toxins.
one more thorn in your side or in your shoe that we just don't need to introduce when we already know that there's nothing great that's going to come from it.
Right.
And especially because today people use alcohol to cope. And this is a problem.
Yeah. And
if they're using it for coping, then it really needs to be looked at. So yes, raises estrogen, which is not a good thing in either gender, but especially in men. Because high estrogen is as symptomatic as low testosterone. Most doctors, in fact, Amy, don't even measure estrogen. They just measure testosterone level, and if it's low, they give a man testosterone. And the guy might feel better for a short while, but then he levels off because what's happening is his estrogen was never addressed.
Oh, okay.
Or given testosterone supplementation or therapy, a lot of the testosterone will spill over into estrogen in the body. Again, if a man is not given a proper estrogen blocker while he's taking the testosterone, this can cause estrogen dominance. Again, limited, yes. But my patients routinely, because I measure them twice a year, at minimum, we see a healthy rise and maintenance of their testosterone level, their T level, and we see a drop and healthy maintenance of the estrogen level. And if you're not doing that, watching that testosterone-estrogen ratio, making sure it's proper, the gains are going to be short-lived, if any. And that's the take-home message for today with regards to health, hormone health.
So if I'm a man watching this, what are some maybe some cues or something to watch for that maybe my hormones are, maybe my testosterone is out of whack? What
The
should I
classic
be?
ones, well, of course, we look at, virility, but, a lot of things that are not typically attributed to hormone deficit in men or hormone imbalance in men should be looked at. For instance, lack of drive, depression, anxiety, short-temperedness. These are things on the emotional plane. Of course, the midsection weight gain needs to be looked at. Fatigue, pain tolerance or pain levels, or lack of energy or muscle strength or muscle mass, bone density. And there are things that are typically not measurable, such as the health of the heart. In fact, is very dependent on healthy testosterone levels. You can't feel that. But you can actually reduce your risk of heart disease by having a healthy testosterone level.
Oh, okay.
Yeah, because the heart is the most important muscle of the body, and testosterone is going to keep that heart muscle in tone as well.
Okay.
So there are things you can't feel, and as I mentioned, bone strength. Men need to be concerned about bone strength, and so that too responds quite well to the androgen we know as testosterone. So when we test men, we look at testosterone, we look at estrogen or estradiol. We look at dihydrotestosterone, which is a stronger predictor of male function than testosterone itself, and then DHEA. Those are the 4 predominant hormones we're looking at. Of course, relative to the big picture of their blood tests, what else is going on metabolically in the rest of their body, their liver, their kidney function, their heart function. And without the hormone piece, there's a major chunk missing in a man's long-term health prognosis. So get out there, men, and get checked, and don't take this stuff for granted. Just because you might be feeling okay right now doesn't mean you will in the future.
Being proactive.
Did you want to say anything about the
Yeah,
oils
well,
or doTERRA supplements?
the one thing that really came to mind is just when you were talking about stress. And, so many men, they work at a desk, they're working in very stressful environments. One thing that, even my husband does, of course, is, put a diffuser in the office right where you're working. And there's been some great studies. There's actually an ER, Vanderbilt Hospital, that actually diffuses their whole ER. And they measured, the stress levels of the people, the nurses and the staff working there. And the drop in stress levels is almost, you almost want to look at it and say that they just can't be, because it was such a significant drop. But they really did have, these great results, less stress, people weren't as overwhelmed. And, being able to use a diffuser in your office and, reduce that stress that dramatically is going to be very, very beneficial for men. And so that's something that they can add. Obviously, a good multivitamin, doTERRA has the Lifelong Vitality Pack, which it is just a phenomenal, vitamin pack. And I love it when I hear people, who start taking it and they get reactions from it so quickly. And you're thinking, it's just a vitamin. How are they getting these reactions so quickly? But, when it's a very well put together, whole food vitamin, they really just benefit a lot from that. So a lot of different oils that men can use as well for a lot of different things, just immune boosting, stress, pretty much anything a woman would use the oils for is going to work for a man too. So men, don't be afraid of those oils. Yeah. You got to smell good. For sure. Well, thank you so much, Dr. Carlos, for talking to us today about men's health.
Another great topic.
Take care, you guys. Bye.